Yes, doctor. Please refresh the browser. We are all back online. Yes. Good, good. So, while downloading that PowerPoint, the whole internet is being sucked by this broadcasting software. So, any other browser won't open. So, we need to go out and restart the broadcast. Thanks for joining back. I have 20 more questions before I sign out. Yes, doctor. A child has chocolate pastry and got diarrhea within 3 hours. Incubation period is less than 6 hours. So same NEETPG, same FMGE exam examiner asked both Bacillus cereus and also about Staph aureus food poisoning. Itna important hai topic. Staph aureus. A 27-year-old female, history of PID, unable to conceive for the last 6 months. What is the next step? You have to do hysterosalpingography. Now let us talk about it, doctor. What is the indication of hysterosalpingography? I am going to be little extensive on this topic because a lot of image-based questions, prospective image-based questions from this topic. Infertility, recurrent spontaneous abortions, any congenital anomalies of the uterus, and similarly for the post-operative evaluation like tubal ligation or reversal of tubal ligation, genital TB suspected cases, we use hysterosalpingography. How does a normal hysterosalpingogram looks like, doctor? Typically, it is triangular, contrast-filled structure with its base on the top and effects caudally, and there will be a free spillage of the contrast into the peritoneum. Now, what are the contraindications of HSG? Hysterosalpingogram. Any acute pelvic infection, Anusha, you are right, but acute pelvic infection, not the past history of PID. Active vaginal bleeding, recent dilatation curettage, pre and post menstrual phase, and tubal or uterine surgery within the last 6 weeks, contrast sensitivity, suspected pregnancy, it is contraindication. So typically, when do you do hysterosalpingogram? That is the favorite single liner of the examiner. First half of the menstrual cycle, in the proliferative phase, between 8th to 12th day is the best time to do hysterosalpingography. Favorite question. What are the complications of hysterosalpingography? Pain, infection, bleeding, vascular intravasation, vasovagal episode, pregnancy. If it is pregnancy, irradiation is a challenge, allergic reaction, and uterine perforation. Now, what are the contrast media which is used in case of hysterosalpingogram? Lipid soluble, water soluble. Lipiodol is lipid soluble. Iohexol, meglumine, diatoxate are all water soluble. Now, are there an advantage of lipid soluble? Definitely. Sharp image, minimal pain, delayed absorption, risk of lipogranuloma formation is very much there. But granuloma formation is not a problem with water soluble. Intravasation of contrast and possible risk of oil embolism will be there with lipid soluble. Pregnancy rate is doubled and it is less often used. Whereas water soluble is most widely used and preferred is what you should remember. Now these instruments in hysterosalpingography is a favorite area, doctor. Leach-Wilkinson's cannula. This is the tenaculum, Hagar dilator, speculum, sponge holder. These are the armamentarium you should be sure about hysterosalpingography. You need to take at least 4 spot films during early filling phase, uterus fully distended, then tubal filling, then peritoneal spillage. All the 4, you need to take 4 films. Then what kind of pathology you can detect, doctor? Uterine and tubal pathology, like uterine anomaly, fibroid, adenomyosis, endometrial polyp, intrauterine adhesions, endometrial TB, cervical incompetence. All this you can very much detect. So this is how a unique cornuvate uterus looks like. There is one cornu, one tube, one spillage. This is also unique cornuvate uterus, single right uterine horn with a right fallopian tube and right side spillage only, left completely not visible, unique cornuvate. Then this is uterus didelphys, means there is a vaginal septum, 2 uterine cavities, 2 cervical canals, and 2 Mullerian ducts. That is uterus didelphys. So this is how the uterine didelphys typically looks like. Tomorrow, examiner is going to give you one hysterosalpingogram image and ask you to identify which Mullerian abnormality it is. Bicornuvate unicollis, that means cervix is only one, but you are having 2 uterine cavities, 1 cervical canal, is called bicornuvate unicollis. So this is how unicollis, bicornuvate typically looks like. This is bicornuvate bicollis. There is one cervical here and 2 cornu. This is another example of a bicornuvate uterus typically that you are able to see. Now, when there is a single cervix, 2 cornu, you have a wide splaying of the horns and the intercornual junction is generally more than 100 degrees. So uterus didelphys means 2 uteri, 2 cervix, 2 vagina. Uterus bicornus bicollis means 2 uteri, 2 cervix, 1 vagina. Got it? Then this is diethyl stilbestrol related uterine anomaly, where hysterosalpingography is showing T-shaped uterus. T-shaped uterus is what you should remember. There is a depression of the fundus, uterine fundus. इसको क्या बोलते हैं? Arcuate uterus. Tomorrow, these are all image-based MCQs. You should not do mistake. Then, septate uterus. There is a septum. It can be a partial septum or it can be complete septum. There is an incomplete resorption of the septum. So this is an example of a gross picture of a septate uterus. Septate uterus typically looks where that septum is extending down is what you should remember. Then if there is a slight separation, it forms a acute angle in septate uterus. So main challenge कहाँ होता है? Septate uterus में it is looking like bicornuvate. Even bicornuvate uterus also you have 2 cornu. It is very difficult to differentiate these two simply on HSG. They are the close differential diagnosis. दोनों में this is septate uterus but you have 2 cornu. MRI is a definitive diagnosis to differentiate bicornuvate from septate uterus is what you should remember. If there is an adenomyosis, irregular outline, multiple diverticulum will be visible. This is on the HSG. This is how a fibroid uterus with multiple filling defects is what you will be able to see. There is a, you can see doctor, here. दिख रहे ना? सबको दिख रहे ना? So this is right submucosal myoma on hysterosalpingography. Then salpingitis isthmica nodosa. There will be multiple outpouchings from the isthmus, and it can be associated with infertility, PID, ectopic pregnancy. So this is how small outpouchings are diverticular from the isthmic portion of the fallopian tube, which is called SIN, salpingitis isthmic nodosum. So you are able to see multiple outpouchings of isthmus in a case of left SIN. Then there can be a development of a hydrosalpinx. Here you are able to see hydrosalpinx. Then this is an example of bilateral hydrosalpinx. Then there can be peritubal adhesions which can develop. And how do you identify? The contrast material become accumulated, and that free contrast spillage will look like a ball. That is how you identify. Then synechiae. Synechiae are intrauterine adhesions, one of the common reasons for infertility. So they can occur because of curettage, which is done vigorously, or infection. They present like a linear filling defect. So this is how a synechiae on hysterosalpingogram will be identified, is what you should remember. Then these are the multiple filling defects within the uterus in case of multiple synechiae. So genital TB may, what are the hysterosalpingographic findings is the favorite question of the examiner. You may find them in fallopian tube or in uterus. Beaded tube, Gulf club tube, pipe stem tube, cobblestone tube, leopard skin tube, hydrosalpinx, peritubal adhesions. They are all due to TB. Similarly, uterus may T-shaped uterus, pseudo-unicornuate uterus, trifoliate uterus. Anything can be the finding. फटाफट एक नजर देख लेंगे ताकि कल के एग्जाम में we are very sure. This is called a tufted tube, multiple small diverticulae, rosette-like appearance, tufted tube in TB. Similarly, TB can be responsible for salpingitis isthmica nodosum. It can be one of the reasons. Then this is called cotton wool-like appearance, where reticular pattern may, there is an accumulation of the contrast in case of hysterosalpingography. And this is multiple beaded appearance, doctor, beads appearance. Once more in TB. Then there can be a circulation on both the sides. It looks like a golf club. Golf club, right there, doctor? Like that is what you should remember. This is called pipe stem appearance. Once more in TB. This is called floral appearance in the left side tube. You are able to see. This is called leopard skin. Leopard skin. You have to imagine leopard skin. ये यहाँ दिख रहे हैं क्या? दिख रहा है. Leopard skin appearance in TB. Then there is a cobblestone appearance because the intraluminal scarring in case of TB. Then there can be a corkscrew appearance like this with the vertically fixed tube secondary to the dense peritubal adhesions. Then there can be a peritubal halo as what you see, where there is a thickening of the tubal wall due to peritubal adhesions, represents a cloudy sign. Cloud दिख रहा है क्या आपको? Cloud है. So that is called peritubal halo. Then very commonly asked MCQ, tobacco pouch appearance, the terminal hydrosalpinx with a conical narrowing, that's what you are able to see. Then there can be intrauterine adhesions and distortion which characterize, and this is called pseudo-unicornuate. The uterus looks like it has only single cornu. Because into the other cornu, the contrast could not pass because of the narrowing down. So only one cornu become opacified on HSG. हिस्टोसैल्पिंगोग्राम, जिसको कहते हैं pseudo unicornuate uterus, is what you should remember. This is called T-shaped uterus, similar to the diethyl silvestrol में जो होता है, similar thing even TB uterus में भी हो सकता है. This is called a trifoliate shaped uterus due to the development of synechiae. Shanti, Shanti, Shanti. Now you are all hysterosalpingologists, right, doctor? So what is the point I want to emphasize to you? अगर एग्जामिनर ऑप्शंस में टीबी है, नीचे HSD है, ऊपर आंसर क्या है? टीबी. That's what examiner is expecting out of you. Simple. Now doctor, most potent antioxidant vitamin E. सब सेंटर लेवल में प्रेग्नेंट वुमेन को टेस्ट करने के लिए क्या मिलेगा? क्वेश्चन नंबर 184. अच्छा, इसका आंसर बोलो डॉक्टर, देखेंगे आप कितना एक्सपर्ट्स, हाउ मच यू आर प्रिपेयर्ड. यस, अभिषेक वर्मा जी बोल रहा है हीमोग्लोबिन. नयमणि Jatin is saying hemoglobin. Then Dr. Uma Maheshwari is saying beta HCG. No. देखा ना, क्वेश्चन से सिंबल रहता, आंसर्स उतना सिंबल नहीं रहता, right? So that is the reason what is important, doctor, not always reading. Sometimes common sense, confidence. First position common sense, second confidence, third concepts. Right? Of course, the above two will come only when you are below third one is good. That is important. Sub-center may, of course, doctor, even beta HCG should be correct. Indira और नागरेड्डी साहब बोलना है, सब सेंटर में बीटा HCG टेस्ट मिलता क्या? Of course, urinary dipstick may be available. So, pregnancy detection test, hemoglobin test, urine test for sugar and protein, rapid malaria test. They are the ones which are available. Indira is saying, Indira is our Principal Secretary, Health and Family Welfare of Telangana. Right? So, वो बोल रहे हैं बोले तो then it should be correct. So, both A and B should be correct. At PHC level, CHC level, first referral unit level में क्या क्या रहता डॉक्टर? You should remember, beta HCG kit is there. नागरेड्डी साहब भी confirm कर रहे हैं. So, blood group, RH type, VDRL, RPR, then rapid test for HIV screening, HbSAg testing, blood sugar testing, they're all available at PHC, CHC, FRU is what you need to remember. Now doc, what defect is seen due to failure of closure of the cranial neuropore? Cranial neuropore बोले तो anencephaly. अब भी आ गया फेवरेट टॉपिक, चलो आंसर बोलो, देखेंगे डॉक्टर. 186 evisceration is the removal of which coat? Question number 186. Punch your answer, doctor. Punch your answer. So life is good is proposing A plus B. Shweta also. Nayomani says scleral shell. At least today I have an opportunity. 3 दिन में शादी है, शादी के पहले opportunity to correct enucleation, removal of the eyeball with a portion of optic nerve from the orbit. See doctor, orbit means that bone, skull का bone है ना, वो orbit है. Orbit में eye के साथ there are other structures also. So if you are removing eyeball, preserving all other orbital structures along with a portion of optic nerve, that is called enucleation. What is an absolute indication for enucleation, doctor? Definitely आएगा कल के NEETPG में. Retinoblastoma, malignant melanoma. Barabar? Then what are the relative indications? Relative indications for enucleation. This is bulby, endophthalmitis, painful blind eye, mutilating ocular lesion, anterior staphyloma, congenital anophthalmia, severe microphthalmia. Relative. But retinoblastoma, malignant melanoma, absolute. Then doctor, removal of the eye with its inner two coats, leaving behind the sclera and extraocular muscles. So enucleation में पूरा आंख निकाल देते, मगर evisceration में you will leave behind the sclera and you will be leaving behind extraocular muscles. So that is called evisceration. Now, you don't do evisceration in malignant conditions. Malignant conditions बोले तो in nucleation, nucleus निकालना पड़ता. Malignant बोले तो. Whereas evisceration में you don't remove malignant things. So panophthalmitis, expulsive choroidal hemorrhage, bleeding anterostaphyloma, endophthalmitis not responding to antibiotics. That is evisceration. Now doctor, exenteration. Is a live broadcast clear and visible, doctor, for everybody without blurring? Be sure. Yeah. So the most radical is exenteration. So what is exenteration, doctor? Removal of the eye, adnexa, and even part of the bony orbit also. So where do you do that? Large orbital tumors, orbital extension of a intraocular tumor. So malignancy में exenteration is okay, evisceration not okay, enucleation okay. Okay, that's right. So very good, doctor. Now, so evisceration, contents of the eye are removed but the outer layer of the eyeball, sclera is left intact. Enucleation, entire eye including the globe is being removed but the orbital contents are left. Exenteration, the contents of the eye socket are removed including muscles, lacrimal gland, optic nerve and various bones also of the orbit is what you should remember. बराबर? Clear? Very good. कल के एग्जाम में आए तो WhatsApp में मुझे लड्डू पैकेट दिया ना. So doctor, let's quickly go to the next question. Convolute uterus is seen in which condition? Abruptio placentae, concealed hemorrhage. Most common cause of postpartum hemorrhage is atony, uterine atony. 45-year-old male, brought to casualty after a night party, epigastric pain penetrating towards back. Obviously, pancreatitis is the diagnosis. So serum lipase is best for diagnosis. So all standard topics, pancreatitis, a question on ORS. Tomorrow NEETPG also will be like that only. Now how many calories are required additionally for a lactating female in the first 6 months, doctor? 600 calories. Hip to pelvic ratio in female and male. Don't try to test it in exam hall. 0.7:1. Female has a wider pelvis because she is the seat of the cradle of the civilization and evolution of the mankind. Fifth vital sign क्या है, doctor? Come on, who is there to give me the answer? Question number 192. Straight, if you correctly answer to MD anesthesia seat दे देंगे. चलो, fifth vital sign. Correct answer को MD anesthesia seat is offered. Deepika Bagaria, you are born to be gynecologist, Deepika ji. आपका co-pilot should be an anesthetist. Praveen Kumar also clean bowl. Nayamani clean bowl. देखा ना कौन बोला एफएमजी का बहुत इजी है, बीच में ही 30-40 क्वेश्चंस हॉट क्वेश्चंस देता है एग्जामिनर. एक्सेलेंट. खिलजी गेमर. Pain, absolutely right. Pain. The fifth vital sign, nowadays they abandoned it. Pain is considered to be fifth vital sign in some organizations like US Veterans Affairs, but it is no more used. Pain is measured on a 0 to 10 pain scale based on subjective feeling. Hence it is unreliable, this fifth vital sign. Now, there is no standard sixth vital sign, but end-tidal CO, functional status, shortness of breath, kite speed, delirium, they are called sixth vital sign. Which insecticide is the insecticide of choice for Kala Azar? Simple question है ना? चलो देखेंगे कितने लोग आंसर राइट आंसर करेगा. फटाफट आंसर करो डॉक्टर, देखेंगे. एफएमजी बहुत इजी एग्जाम बोल रहे हैं ना, देखो हम देखेंगे कितने राइट आंसर करेगा. मोहन बाबू, अनुषा क्लीन बॉल, जगदीश्वरी, श्वेता झा फ्रॉम नेपाल, नयमणि. Excellent. DDT is what you should remember. Indoor residual spraying is the simplest, cost-effective for controlling endophilic vectors, and DDT is the insecticide of choice for leishmaniasis. What is an amplifier host of Japanese encephalitis? Pig. Now, a person says, I will go home sweet home, sweet urine. What is this called as? देखेंगे भाई आप में कितने लोग मन की डॉक्टर बनेगा, तन का नहीं मन का. Shoot your answer. 195. Yes. Punch. Abhishek says circumstantiality. Chaudhary साहब बोल रहे हैं flow of ideas. Anisha Chaudhary, Viresh Mohan, Roshan Yadav. Excellent. Flow of ideas. जरा हम psychiatry का jargon पढ़ाई करेंगे. भैया what is thinking? A goal-directed flow of ideas initiated by a problem and leading towards a reality-oriented conclusion is called thinking. Circumstantiality. Thinking will proceed slowly with many unnecessary trivial details, but finally the point is reached. My lord, point is reached. Objection overruled. Thinking proceeds slowly. That's the only difference. With many unnecessary trivial details, but finally point is reached. Goal of thinking is never completely lost. Then historically this is regarded as a trait associated with epilepsy. And if you don't interrupt the speaker, finally he will reach the point. That's the point. So when I used to be undergraduate student, I used to do virtually cross-examination of any professor. If professor says, nuclear polymorphism is a sign of malignancy, I used to say, sir, there is a osteoclastoma, there also there is a hyperchromacity of the nuclei, right? So, osteoclasts, do you call them as malignancy? Oh, being capsulated is a sign of benignacy. Immediately I used to show, these are the 4 tumors which don't have capsule but still they are benign. So, Our professor used to say, still remembering pathology professor, Murli, stop. Let me finish, please, let me finish. Then you ask questions. He used to virtually request. So, बहुत मजा आते थे. So to pull his leg, that is a driving force to study. I'm telling you now, a good student becomes best student if he tries to start teaching. The best teacher become the good teacher become the best teacher the moment every day he becomes a student. That is the simple rule of life. So tangentiality, it is a kind of derailment. The patient is wandering from one topic to another and never returning to it, or he is unable to provide the information requested. Suppose if you ask him a question, example of tangentiality. Beta, where are you from? He will start answering. My dog is from England. They have good fish and chips. And the fish breathe through gills. Gills are evolved from something else. Right? Finally, where are you from? You could not get the answer. That is tangentiality. Now, what are imperative hallucinations? Patient will keep on listening voices, giving instructions, who may not be or may be obliged by the patient. Similarly, now, thought echo, hearing one's own thoughts being spoken very loudly is called thought echo. Running commentary hallucinations, they are usually abusive and talk about sexual topics. Running commentary hallucinations can be formed. Then what are extra-campine hallucination? A hallucination which is outside the limits of a sensory field. It's called extra-campine. Extra-campine hallucinations are hallucinations beyond a possible sensory field. For example, you are able to see somebody who is standing behind you. That is extra-campine hallucination. Right? Now, hypnagogic, hypnopompic, what is the meaning? When a hallucination is occurring when you are falling asleep, you call hypnagogic. When you get a hallucination when waking from the sleep, that's called hypnopompic. That's what you should remember. Then autistic thinking. It is a form of thought disturbance where it refers to the thinking not in accordance with the consensus reality, and it emphasizes preoccupation with some inner experience. That's called autistic thinking. Then abnormalities of stream of thought, flight of ideas. Thus, one after that, like our FMG paper discussion, samjho. The thoughts follow each other rapidly and there is no general direction of thinking. It is found in mania. Pressure of thoughts, rapid, abundant, varying thoughts associated with pressure of speech and flight of ideas. That's what you see in mania. Poverty of thought. Few, slow, unvaried thoughts associated with the poverty of speech. Sudden block of the thought flow is called thought block. Then what are the abnormalities of the form of thought? So, disorder of conceptual or abstract thinking. Formal thought disorder. Typically it happens in schizophrenia or any brain disease. Then loosening of association. A thought disorder in which a series of ideas presented with loosely apparent or inapparent logical connection. ये idea और next idea को connection नहीं रहता. So the patient's responses do not relate to the interviewer's question. For example, I sang out for my mother, for this to hell I went, how long is the road? How long is the road? So this is an example of a loosening of association. Derailment क्या होता है? The direction of the thought is lost and the thought goes away from the intended theme. Example, the next day when I would be going out, I took control, like I put bleach on my hair in California. भैया तो घर से बाहर निकलने का, वहां से कंट्रोल लेने का और ब्लीच लगाने का कुछ संबंध है क्या? नहीं है. इसको बोलते हैं डिरेलमेंट. Neologisms, that is English plus Hindi. English में लेक्चर दे रहे हैं बोले तो Hindi plus English, neologisms. Then what are overvalued ideas? Overvalued ideas is an example of abnormality of thought content. Right? Form of thought, flow of thought, content of thought. Abnormal beliefs unique to the individual which dominates his life is called an overvalued idea. Example, a woman falsely believes herself unusually unattractive. तुम कुछ भी बोलो, भाई तुम सुंदरी हो, नहीं मैं बंदरी हूँ. Right? No, तेरे आंखें बहुत अच्छा लगते, तू सुंदरी हो, नहीं मैं बंदरी हूँ. Right? So that is called overvalued idea. Delusions are what? Fixed false beliefs which are not shared by others and are out of keeping with one's own educational, social, cultural background, but they are unshakable in spite of showing an evidence on contrary, is called as delusions. So you have to be very sure on all this terminology, doctor. एग्जामिनर पूछेगा. इसके पहले भी हम साइकियाट्री में बहुत डिस्कशन किया इसके बारे में. यू हैव ऑल दैट इन द ऑनलाइन mbbs.com वीडियो लाइब्रेरी. When will you do lumbar puncture, doctor? L3 to L4. Leukoplakia, erythroplakia, oral submucosal fibrosis. They are all pre-malignant in nature, not aphthous ulcer. Hypovolemic shock में what is the organ first affected? Kidney is first affected. Pyruvate dehydrogenase complex में what do you have? Lipoate, coenzyme A, FAD, NAD plus. Beautiful question. Come on, who is going to give me the answer, doctor? We are going to wind up today's evening with this last question. There are 100 more questions in the FMG June 2019. As I all promised you, next 2 days, afternoon 1-2 घंटे आपके साथ और रात 11 to 1 AM, 11 PM to 1 AM. सो जा राजकुमारी सो जा. So I will play the lullaby for you to go to sleep by conducting a session at 11 AM to 1 PM, 11 PM to 1 AM, right? So, what is your answer, doctor? Question number 200. Very good, very good. Anisha Chaudhary, everybody, laryngeal carcinoma. So, what do you mean by high tracheostomy, doctor? First tracheal ring. Now, the high tracheostomy is generally avoided because there is a chance of perichondritis of the cricoid cartilage, subglottic stenosis, etc. But in case of carcinoma larynx, where there is stridor, when total laryngectomy would be done, a high tracheostomy is very much indicated in laryngeal cancer. Mid tracheostomy बोले तो second and third tracheal rings के बीच में, it involves division of the thyroid isthmus. Low tracheostomy is below the isthmus, where trachea become very deep and it is very close to large vessels. That is the big challenge. So, doctors, मेरे प्यारे नन्हे मुन्ने NEETPG aspirants, thanks for giving your wonderful time with Dr. Murli Bharadwaj. Once more, हम सब मिलेंगे रात 11 बजे को और कामयाब होके दिखाएंगे आने वाले NEETPG में. Have a good evening and enjoy a quick consolidated revision. Right, Doc? Bye-bye.